But there are some questions about this corner selected. We selected that we remove the corner section. So where to start from the telegram? Okay. Called from a farmer accidentally put into a farm a sharp blade with wife in the field. What is not recommended option? Scrub the wound while washing. Bracket with 22 slot. The wire would fill the slot for the top. The best wire. A 1925 SS, a 2020. 1925. 19? No. No, the comparison is here between the two SS wires. That in 1925 SS wire and 20 multiple 20. Right? Yes. So when we put a 1925, the the main issue is the height, not the depth. The 25 is the depth. Right? So in the 19 dimension that matters rather than 20 dimension. So, sorry, the 25 or 28 dimension, because this is the height and then the depth. So I think a 20 multiple 20 wire will fill the slot more. I think also answer 1.2 million. Theoretical 2 to slot brackets are more efficient in sliding mechanics. Effective torque control, faster tooth movement, effective tooth movement, lesser root absorption, controllable sliding mechanics. You did third order band. When you place the wire, it's light, flat. What's the effect? Level crown torque, keep mesial tip. I think we solved this question. What was the option here? It was on wagon wheel effect. So when you did third order band, when you place a wire, it light flat. What the effect? Light flat. Label crown torque, keep third order band depends on the type of bands, like what is positive or negative, right? If you are keeping a like what giving a positive torque, then in that case the tip is decreasing, right? And the roots are moving mesial and intrian. I don't know. I explained this previously, like but when you are giving a positive torque, right? So the crown will move forward, it will move slightly upward, right? So there would be some intrian effect, and the tip would like what the neighboring tooth like what as a whole in the due to the wagon wheel effect, the tip will decrease and the torque will increase. And if we give a bend, like what we have to for the positive torque, we have to bend the wire upward, so the tooth will like what slightly intrude. Patient is patient thumb sucking while after counseling patient led treatment quad helix. Posterior parents and kids. Patient thumb sucking after counseling parents and kids treatment. Quad helix, bitter gels, psychotic. Early, yes, a band or something like that. Because the question that is coming is that the patient came, thumb sucking, posterior cross bite. The counseling and these techniques have failed. So the posterior cross bite is there. So you give a quad helix. Now I'm going to the shared one. Just okay. Management no. This is after the YouTube video. 11 years present with MIH. First molar is symptomatic causing pain. The second molar has almost erupted while the third molar is developing. What are the possible instruction to the pediatrician? Right one is complete composite filling, pulpotomy and metal crown, gold crown. So it's 11 year, it has passed its age. And if we can do a pulpotomy and if there are no other features, we can do D. And it's like what permanent molar, it should be pulpectomy rather than pulpotomy. Why? Yes. But other features of the maloclean will matter because the ideal age is gone. That is 9 years evidence about. So other features are not available here. So uh, even pulpotomy is not an option. It should be pulpectomy. This 14, I cannot. Do you please people see the picture? Can you see the picture? As we cannot see the picture, so we won't solve the question. Even I do not know what is in the picture. He has no realm. She has there. It's a geographic tongue. Yes. And tender on spicy food. We discuss. We show the patient. The yes, the question came again. Okay. This is a basic BP of the 18 years old patient who is wishing to undergo what is the most. So it's three. We have treated three. Treatment can commence following back oral hygiene instruction. Treatment can commence following a full mouth. The patient requires management of stabilization periodontal health before orthodontic treatment can be planned. The patient may require extraction of teeth. No. Might be D. Treatment commence following oral. No. Is with no orthodontic attachment loss. No. Treatment can be commenced following the basic oral hygiene instruction. No. Treatment can commence following a full mouth scale and polish. But there should be a root surface debridement too. The patient requires management and stabilization periodontal health before orthodontic treatment. I think D. Is positive talk there is a loss of teeth and extrusion. Yes, in positive talk there is a loss of teeth. But Dr. Junaid said, and there is extrusion. Okay. A 25 years old patient was undergoing orthognathic surgery. Examination reveals that class 3 maloclean due to larger lower jaw and anti-open bite with increased vertical proportions. A positive cross bite was also present. A positive cross bite. 25 years orthognathic examination class 3 maloclean with a large lower anti-open bite with increased vertical. It has decided to go for orthognathic surgery, which nerves to be affected during surgical procedure. Anyone can help, like what I know it's inferior alveolar nerve, and the rest it depends on the type of maxillary surgery. Nasopalatine, yes, incisional nerve can also have a damage. Inferior alveolar nerve, facial nerves can also have a damage. If we even give it torque, the wire is going upward, positive torque. For invert is for the negative torque. Yes, then in that case, that will extrude. Yes, yes, I think it's willing to. So anyone for this one, which nerves, because it would be written in profit somewhere. Also, the facial nerves sometimes are damaged while doing the maxillary surgeries. Infraorbital inferior nerve and facial nerve. See, if it's a lipo 2 osteoartery, I'll try to find the answer of this one. Might be from surgical profit. A 13-year-old came into your department with a cleft lip and palate and open bite. She complained irregularity and difficulty in speech. She has a reverse jet of 4 millimeter. I think 5P would be important. There is a controversy, but many people say that when there's a cleft, P will come first. You notice increased vitamin. You can. How can you solve? Read any literature, compare with another orthodontist. Read systematic review based on RCTs. System based on case control. Read all recent evidence. Compare with another orthodontist. No. Read any literature. No. Based on randomized clinical trials, and that should be recent because recent evidence like what that can be good, but depends on what type of level of evidence you are reading. Because even in the hierarchy of evidence, there are personal opinion at the lowest level of evidence. So I would go with C, but 30 years old for emergency appointment complaints severe throbbing pain on the upper molar. He say he cannot eat on effective food examination. You see periapical abscess. B. We failed to solve this question previously. We think that all the options are not there. So because the OPG dose is very variable, right? And the standard like a dose of upper occlusal is something from 35 to 45 microsieverts or 50 microsieverts. So it can be like a double. It cannot be the same, and it cannot be 8 times, 5 times. So it can be double or 3 times. Upper occlusal view of a cleft lip patient, recent bone graft, and the canine is erupting through the bone. About two-thirds of the three-quarter of the root is formed. Do you think that the graft was done too early? Of a patient who has recently bone graft, I don't know how recent, like, but if it's 4 months, sometimes the canine do erupt from there. So we need more information. Best reminder of a patient low inside the crowding. Best retainer. Fix Holly, fix plus VFR. And according to Martins, because the recent system opening review is now by Martins, there's no evidence like what visual retainer you would select. A patient with missing upper lateral incisor, you want to close the spaces. What is the next step? Reduce the canine tip to precise the vertical position. Invert the canine bracket. Put the. It depends like what which tooth you are considering. And even in MBT, they have positive torque, negative torque for the canine, and zero torque. So cannot be solved. You debonded the fixed appliance and you want to take alginate impression and found that the technician will not make the as expertise of what you will do. Extracted alginate and store in tower, no. Store in what? It's extended alginate. Store in refrigerator, no. Yes, wrapped in a wet towel, not in dry area. Plastic bag. Yes. D. Photo of a patient with rebonded bracket and rotated low incisor. What the most suitable wire to use? Stabilize patient with bonded bracket and rotated low incisors. If it's rotated, then M night eye. Active M night eye. Martin, 32 years under radiotherapy since 12 months, and he suffers now from the mucosa, little burns, and temporary cervical gland dysfunction, current risk of final poison, somatic circulatory effects, deterministic effects. It's somatic, stochastic, certain somatic certainty effect that are deterministic effects. Your specialist cleft now inform your child was recently born in your husband period of incident, as well as you reporting give the child with a cleft palate, which measures would need to take his baby. Placement of a feeding tube, yes. Lip strapping, also yes. Yes. Eye screening, early palate repair, positive pressure, breathing appliance. Additional measures you will take, not the initial. So I don't know that you are giving the regular sport. They said that apart from the usual sport. So in the usual sport, we place a feeding tube. We do the lip strapping. Uh, some eye screening is not very important. We go for the alert palate repair, but that is at 6 months. And positive pressure breathing appliance, that is also the usual measure. So I don't know which usual measure have been taken previously. So I can go for the other measures. Might be E. But sometimes they have breathing difficulty and so much that they do the tracheostomy at the start. I'm going to the next question. In cephalometric tracing, the most stable maxillary superimposition structure is lower contour of the hard palate, no. Anterior surface of the zygomatic process, yes. Anterior contour of the hard palate, no. Upper contour of hard palate, in B. He can start to seize, and after he stopped, gain consciousness while waiting for the ambulance, give oxygen. And if he's conscious, do nothing. Do not give anything. See. 3 months after bong fix applying, the patient attended with Leon on mucosmem 3 months after bonding. What you'll do? Remove night leave the bracket and you show the patient for remove SS bracket and place night refer to skin prick testing. Patient, show the patient, remove the brackets immediately. I think it should be a patch testing because the skin prick is, yes, so it's a patch testing you have to do. And it's 3 months, we won't remove the brackets at that time. A child referred with his mother from general dental practice. His mother asked about maintaining space of his extracted second deciduous molar because they were unrestoreable. The decision between bending first molar and the first permanent molar will give band and loop space. The decision between bending first deciduous molar and the first permanent molar. Ideally, the age of the patient should be mentioned. Might be the 6 is not interrupted at 5 years of age. Morphology difference between the deciduous and no. The extent of development of the second premolar relative to the first premolar. Yes, that is more important. Might be that the extent of the root absorption, no. The extent of root length. I think B. The remaining space between the first molar and the first deciduous molar. That is also important. Yes. And I think E is more important than giving a space maintainer itself. Might be the space is not there. Then his hand will start to shake for a minute. What is your line of treatment? Then his hand and limbs start to shake for a minute. Epilepsy, but a small attack of epilepsy. Ideally, there should be done nothing if it's for a minute. And if it's like what, yes, even it's dizziness, hypoglycemia, that can also occur. In that case, administer glucose. but it seems epilepsy. Yes, but he's fine now. Then his lip start to shake for a minute, only for a minute. So if epilepsy do nothing, like, but if these are not the options, then I will go for the administrator of glucose. Might be saying hypoglycemia because dizziness. I don't know.
Yes.
103. I cannot see the picture. Yes, multiple X clinically from OPG followed by upper occlusal. Upper standard occlusal low. C. Sarah said that give sugar to the last patient. Let me see. She said she will go with glucose for D administered oxygen. But if it's epilepsy, yes, yes. If the epilepsy attack is over, do nothing. What is the most common treatment in adult patient with severe increased vertical height? Leopold 1, BSSO, no. Extraction of the first one, no. BSSO, no. Maxillary surgical impaction, D. Okay, we solved all the questions. I think we have to solve this question, that vision of damage. I think we need to find it from profit. Surgical profit, yes. Yes, seizure for 1 minute and then the patient seems stable. So what should we do? Like what the guidelines are, I will go to the guidelines. More activities. Okay. Medicine. Patient loss of sudden loss of consciousness. Patient may be great fall, might carry a cry and become jerking movements. So this is the case. Assess the patient. Do not restrain consciousness. Ensure patient not at risk. Secure the patient airway. Administer oxygen. The seizure will typically last few minutes. The patient might then become floppy but remain unconscious. Once the patient conscious, they may remain confused. However, the plague reported for long, 5 minutes or longer, then like what you go for the administration of oxygen. And then like what midazolam. If it's fine after 1 minute, one can select the oxygen option. Yes. Yes. Okay, she said that after gaining caution, oxygen is given. Yes, oxygen should be given. She said that after gaining, oxygen should be given. So I think we solved epilepsy. Okay, D. There was also another question of epilepsy. No. Okay, we solved this one. Yes, if more than 5 minutes, we does along. Thanks a lot, Dr.